And now we'd like to welcome you to our interactive session right here on Business News, where we are joined by Kenya Medical Practitioners and Dentist Council CEO Dr. David Kariuki for a discussion on Kenya as a medical tourism destination. Welcome, sir.
Thank you, thank you.
All right, to kick us off, you just released a report. Perhaps kindly provide a brief overview of the recent report released by KMPDC that revolves around Kenya's potential to become a potential medical tourism hub.
Well, thank you very much. I think as a beginning, we would want to tell Kenyans what Kenya Medical Practitioners and Dentists Council is all about. It is the agency of government as a semi-autonomous agency in the Ministry of Health that deals with the regulation of the practice of medicine and dentistry in the country. This means that we do regulate and put the norms and standards for those who want to practice medicine in the country. We also are involved in regulation of hospitals, that is anyone who would want to provide health services in the country. Currently we have over 14,000 registered facilities in the country and over 15,000 registered doctors and dentists. But you find that despite this, sometimes we may not have all the equipment, all the facilities that we may need in the country, and a few Kenyans have opted to go and have their treatment undertaken outside of our borders. So the Kenya Medical Practitioners and Dentists Council is usually involved in approving treatment outside of our borders, and especially for those who will require financial support by the National Health Insurance Fund, which has been in existence, but as you are aware, now it is transitioning to what is going to be called a social health authority. When we look at the trends in the last 1-2 years, those who have gone through the Kenya Medical Practitioners and Dentists Council approval were about 569 Kenyans to destinations across the world, mostly in Asia, a few in Africa, and some in Europe. In Asia, most went to India.
All right, then. So what does Kenya need to effectively what does it need to do to effectively compete with other medical tourism destinations such as India, the UK, Singapore, among others?
Thank you. Just as a background again, those who went out mostly went to India. And the reasons they gave were that their perception of that it could be more affordable in terms of cost, that it could be cheaper. They also feel that the facilities there are more advanced than what we have here. And sometimes just want to get that second opinion on what their ailment could be and whether the treatment they had been advised while back home is still what would be required for them to undertake. Looking again at the kind of illnesses that take people out there, we did notice that most went out for heart surgeries. Others went for treatment for cancers, various cancers, like the blood cancer called leukemia. Others went for liver transplants because of liver cancer and such other treatments. And a few went just for a second opinion. So for us to be able to stem this tide of patients or clients having to go and seek treatment out of our borders, we then need to invest more, especially in the management of the more complex diseases that have been making our people go, and also look at the issue around affordability. And when you look at these things, we as KMPDC, as part of government support towards ensuring that services are getting closer to Kenyans and to our people within our borders, and even open up to people from outside our country, we in terms of increasing the number of specialists, we now have the kind of capacity in terms of human resource that can be able to undertake those surgeries. Very many heart surgeries are now occurring within our country across various tertiary hospitals, both government and non-government, to mention hospitals like the Kenyatta University Teaching and Referral Hospital, the Kenyatta National Hospital, the Moi Referral Hospital as government hospitals, and then we also have private hospitals that are of the level 6 that can undertake that, maybe Aga Khan, Nairobi, Karen and such. So therefore meaning that we have started increasing our capacity in terms of human resources. We are also increasing capacity of the hospitals by them investing more in necessary equipment. I'm sure that all Kenyans have seen of late, like what has been installed in at the Kenyatta University Teaching and Referral Hospital, what was called the CyberKnife, which is an advanced treatment for cancer. They also have introduced other imaging modalities that make us be more precise in terms of the diagnosis of the ailment. And just to take you back, for those that had gone out of the country, at least 20 of them had gone out for CyberKnife treatment, meaning that now that our country has installed this equipment, we will now no longer require those people who had gone out for that to be able to go. I think another investment that is being undertaken as a reform in the health sector, as you're already aware, is that recently His Excellency the President signed into law what is called the Social Health Act. One of the key things around the Social Health Act is to ensure that affordability will now be one of the key issues that will be covered through health insurance that will be available to all wananchi, irrespective of their ability to pay. So these are steps that are being taken by our country to ensure that services have gotten closer to the people. One of these investments also is ensuring that now we will have more people coming into our country because of the investments that we shall have done in and are doing in terms of our specialized human resource, specialized medical equipment. For example, the Moi Teaching Referral has done or treated over 250 patients from across Eastern Central Africa. There are many other numbers that are there across our tertiary hospitals.
Very well. You
Yes.
mentioned the private sector. So in this case, what do you think the role will be of private sector? Or which role will they play in advancing medical tourism? And could you elaborate on specific contributions expected from the private sector?
Thank you. The private sector plays a key role in overall service delivery for healthcare. One, in its ability to partner with the government to ensure that services are available in the country for where the government may not have fully invested in a certain expertise or speciality in terms of equipment or facility, let's say, operating facilities, medical equipment, like machines to make diagnosis, to diagnose in the laboratories, in the radiology departments. The private sector can be able to invest in that, and public partnership collaborations can also help. As a recent example, you have seen how what was called the medical leasing equipment program did to ensure that services across the country were becoming available. For example, before that program started, kidney dialysis was not available across the country. It was only available in about 2 hospitals. But today we are talking about 50 hospitals that are able to provide that. That is part of private sector involvement in service delivery. And then there is the individual private sector, investment by building hospitals, building, diagnostic and radiology facilities across the country, training, because some of them also offer training, and they offer training for specialized cadre of staff like specialized nurses, specialized doctors. And in this way they get to increase the capacity of the country to absorb numbers of patients from outside the country that will be able to improve our economy.
Well, thank you so much. I'm told we've run out of time. We should invite you back to continue this discussion. Yeah. Would like to thank you so much for gracing us with your presence. Well, that was Dr. David Kariuki, who is the CEO of KMPDC. Now, we shall be moving on to other news where hosts Ivory Coast eliminated reigning champions Senegal in a 5-4 penalty shootout to book their place in the 2023 Africa Cup of Nations quarterfinals following a 1-1 draw after extra time. Now, Cape Verde defeated Mauritania 1-0 to book a place in the quarters for the second time. Tonight, Mali will face Burkina Faso at 8 p.m. while Morocco play South Africa at 11 p.m. and both matches will be televised on KBC Channel 1.